Good morning, everyone. A warm welcome to all our speakers, to all our participants. Thanks so much for joining us today. My name is Liisa-Maria. I'm the Secretary General of the European Health Forum Gastein. And as you know, some of you may know, the EHFG this year is going online. So we decided to dive into the online experience already during the summer by starting a summer webinar series. And you're joining the first of this series today, which will focus on one of our 4 pillars, the policy sector. The EHFG rests on as I said, 4 pillars. We also try to engage the other stakeholders group from the private sector, from civil society, and from academia and science. And what we usually try to do in Gastein is what we are trying to do also here today. On the one hand, we want to involve different stakeholders, as I said, but we also want to ensure candid exchanges. We want to ensure timely discussions, and sometimes they can also get a bit controversial, as some of you may know. I'm therefore really excited about our lineup of speakers this morning. And I'm also excited to have our our good friend Nick Fahy with us today, who will moderate this first webinar and who will guide us through this. So thank you very much for that. Thank you for all our speakers for joining us today, and for all of you in the audience. And we look forward to a great session today. Over to you, Nick. Thank you.
Dolly, thank you very much for the introduction. Thank you for the invitation to moderate today's event. Good morning, everyone, or good afternoon, depending on where you're joining us from. So, as Dolly said, this is going to be an exciting event. We'll do our best, Dolly, to be a little bit controversial if we can be. I'm sure, knowing the eminent speakers that we have around the table today, that will not be a problem. So we have representation, we will have contributions from a national policymaker in the form of Liisa-Maria Voipio Pulkki, although unfortunately she's so involved in national policy making that those will be done by video today. We have, of course, Andrea Ammon, who is the director of the European Centre for Disease Prevention and Control. We have Josep Figueras, who is director of the European Observatory on Health Systems and Policies. Trish Greenhalgh, who is Professor of Primary Care at the University of Oxford. And if emergency situations allow, we hope also Dorit Nitsan, who is the Regional Emergency Director from the European Regional Office of the World Health Organization. But we also have you, audience, and we are looking forward to your involvement. So we hope that we are going to have your input in the form of, well, questions and answers, but if you look at the Q&A section of the session today, you will see that we have a polling question there, a link to Wisembly, where you can already take part in our first poll. So our topic today is about evidence, about this balance between, on the one hand, we want robust evidence, on the other hand, we've seen that we need answers to questions really quickly. So what's this balance between speed and perfection of evidence? And so let's test out your IT skills with the contribution of the audience with our first Wisembly poll. So you can see up there on the screen, in your opinion, which principle has been the driving force behind the COVID-19 response in your country? Is it epidemiological data? Is it politics? Or is it economics? And you can respond, you can give your answer to that via the web link or through your phone, through the links which are in the Q&A. And while you're all doing that, the format for today is going to be, once we have your views on how you think this tension has been resolved, I'm going to go through each of our speakers and ask them for their initial perspectives on that. We're going to get their initial thoughts on these different perspectives we have represented today. You will undoubtedly listen to what they say and have your own things that you want to ask them and your own questions. Please put those in this Q&A channel. Please pose questions there, and we'll then come into the second part of the seminar this morning with another Wisembly poll, but then also drawing on your questions from that Q&A. And so we're going to have a mix of some initial rounds, some thoughts from the different panelists, and then responses to the questions that you all come up with. Now, hopefully you've had enough time now to vote. Oh, one final thing that I should just say, I think you've seen it up there. If you're on Twitter and you want to, then you will see the hashtags up there for today's event. Gastein colleagues, are we ready to show the results of this first poll? Well, do you know what? That's very comforting. Most people, by 1%, think that epidemiological data has been the driving force behind the COVID-19 response in their country. But a close second is politics, and economics doesn't seem to have been a factor. I look forward to discussing this further with the different experts as we go around it. So thank you for that. Thank you for showing us those results, colleagues. I think what I'd like to do now is move towards our speakers and turn to our different speakers and ask them the questions that an initial round of questions. So I said that our first speaker today was going to be Liisa-Maria Voipio Pulkki. She is very closely involved in advising the government and the Prime Minister in Finland directly on the response to coronavirus, and so unfortunately was not in the end able to join us for this event now, but we're all experimenting with new technologies, and so she was able to record some responses to the questions in advance. So earlier I asked Liisa-Maria, as a policymaker in the Finnish Ministry of Health and Social Affairs, what were her key information needs at the outset of the pandemic, and how far did she feel that those needs had been met?
Good morning, and thanks for the invitation to discuss these really interesting questions. The first thing that actually came to my mind was how little we knew of this new coronavirus, its basic biology and the disease spectrum caused by it during the first weeks of the epidemic. We actually only knew the tip of the iceberg. So in our scenarios, we had to rely on epidemiological models, which were more like educated guesses than based on solid science. Moreover, we urgently needed information of the actual epidemiological situation and pandemic preparedness in our decentralized health and social care system. Collecting this information turned out to be absolutely necessary for decision-making in the central government in order to properly target the support to the frontline healthcare providers. Third, in the ministry we needed constitutional legal advice because the Emergency Powers Act was activated for the first time after World War II and gave us as health authorities totally new powers, both politically and operationally. Finding the balance between the right to health and other fundamental rights was and continues to be a debated constitutional issue in this country. Globally, research has made great progress, but there are still significant epidemiological and medical knowledge gaps. The Finnish Institute of Health and Welfare has established a comprehensive and real-time pandemic surveillance database, and the Emergency Powers Act has been lifted, as the epidemiological situation is now very calm. No one knows what will happen next, but at least we are much better informed of the nature of the virus and the pandemic than we were just a few months ago.
So I think that response highlights the challenges that were being faced by national policymakers, and the link also there to the legal challenges as well. This is not just a question of data and evidence, but also of its impact on policy and law. But I also then asked Liisa-Maria what type of data had been the most useful for policy planning and addressing the pandemic response in her country. And as we're just waiting for that, I think I'm going to ask the colleagues there we'll come back to the video in a second, because in the first time, Trish, I know that the kind of issues around these tensions between policy and law that were raised by Liisa-Maria's answer to that first question are also things that you've been quite involved with in your own the work that you've been doing.
Yeah, Nick, I was very struck when I watched that little video clip from Liisa-Maria, who I know. She gave a really good encapsulation of what it felt like to be a policymaker, sort of right at the beginning, when there was no data. But I would push you back on this thing that it was politics or economics or whatever it was in that set of questions, because it seemed to me that what Liisa-Maria was describing in that clip was a kind of what's going on here question, and a lot of different types of evidence had to be brought together. It was partly what's going on politically, what's going on economically, but also what's going on epidemiologically. It was about constructing the beginning of a narrative. And I'm going to refuse to be pushed with your, is it this or that or the other, because I think that video from Liisa-Maria showed that what was happening was people were piecing together a complex narrative. And right at the beginning, one of the things they had to do was count things, because, you know, how bad is it? How many people are affected? How fast is it growing? Those were addressed through epidemiological data. But I suspect that as the sense-making process progressed, the questions actually became less quantitative and perhaps more about values, more about, you know, what would happen if ... So I just throw that in before you play the second video.
Thank you very much. And I think that's one of the things, this whole question about combining and integrating different types of evidence, I'm sure that's something we will come back to. As I said, I asked her about specifically what types of data had been most useful, and let's hear what she had to say in response to that.
For political decision making, ensuring the health system's capacity to meet the epidemic has been the #1 priority for the Finnish government. So, up-to-date information of the epidemiological situation, its impact on the vulnerable groups and on hospital capacity, these were the cornerstones of policy advice for several weeks. However, when the epidemic started to slow down surprisingly quickly, the focus also started to move to the mental, social, economical and political consequences of the pandemic response, both nationally and internationally. Another challenge has been the data showing dramatic reductions in primary care outpatient visits, causing potentially harmful long-term consequences. So, in many ways, the data that is most useful right now has to do with the whole of government and whole of society response during the recovery phase of the epidemic. This also means that data becomes political and is sometimes used selectively and in retrospect. Finally, since there are still big gaps in the scientific evidence to support policy planning, cross-country comparisons have sometimes been really useful surrogates of evidence during difficult political processes, such as lifting the restrictions on mass gatherings.
Excellent. So I'm sure everyone would want me to thank Liisa-Maria for that input, even though she isn't here to hear the thanks, because she's raised some very interesting issues there. And I know that as she says there's the way in which data becomes political, which I'm sure we will come back to, and also the importance of cross-country comparisons, and that leads beautifully into our next speaker. Andrea, as Director of the European Centre for Disease Prevention and Control, you're head of the European agency that is bringing together this comparative cross-country data. But of course, that data is collected in lots of different ways and through different processes and perhaps to different standards in different countries. How have you balanced and mediated that challenge?
Well, I think it was a process in itself that became more refined as we learned about what data are actually available and what we can collect. In general, it's that from the national level to the EU level. So we put out reporting protocols and the variables that we need. So that is fairly standardized. But the data that go into this process come from really a variety of systems, depending on two factors. In this case, one is who is being tested. So the whole approach to the testing strategies it varies quite considerably between countries, or varied at the beginning. And then in second place, it's of course the health systems that produce these data that we know that are different. That is also the same issue that we have for all the other diseases. But for the other diseases, we have time series, so we know over time how it is, and we can assess this. Here in the emergency, what we have seen is that processes also within a country have changed. And so it was not easy to really say and interpret the data that we have. Does a country have few cases because they have no transmission, or because they don't test? Does a country have very high mortality because they have more severe cases, or a worse health system, or because they test only hospitalized patients? So that is the information that we really had to elicit in separate information rounds. The other point was that we have established very quickly a network of contact points of people in the countries who are responsible for these data collections. And we had a very, very intense interaction with them. We still actually have. So that is how we try to make sense. But I mean, we also saw that the data that we usually collect on gender, age, risk factors was not the only things that we needed. We needed to know, I mean, how many tests do you perform? How many of these are positive? Because that is an indicator of the circulation. And also, I mean, how is your bed occupancy in the hospitals? How much is intensive care? How much is normal beds? And then a bit later, when it became very clear that a critical place were the long-term care facilities, that is in some countries not part of the usual reporting. So we also had to draw our attention to these areas.
Thank you very much. And so that's a description of, I think sometimes people think that this whole process of collecting data is just a question of, well, here are the numbers and they send them to you and you put them all together into a database. Yeah. And you and I both know, because we both worked on this from different angles, that you've described there's a whole process of what should be collected, how it should be collected. And the other thing that really strikes me, of course, is that we normally have decades to do this. And this has all been happening. You mentioned time. It's been happening over a completely different time frame.
And so, may I add one thing? It had to be done by people. You know, the whole input had to be done by people that were busy with something else. So we had huge delays at the beginning, which is drove me very fast to the conclusion we have to change in the future the way we do surveillance, because I mean it's taking time of people that have something else to do.
Well, that was exactly one of the things I wanted to ask you about, actually, is what would you change? So how, because obviously this has been in many ways the kind of work which would take a 3, 4, 5 year project of data harmonization and establishing reporting mechanisms and deciding on the scope of what this has all been done in weeks and months and sometimes days. What would you change now? Or what impact do you think this will happen about, or would you like it to have on the future of how data is collected through organizations like the ECDC?
Well, the impact now, I think, as fundamental as I would like it, or what I think it has to be, cannot be done now. That is something that will take at least a medium perspective, because it has to do with digitalization. It has to, and that is not only possible from national to EU level. It has to happen in the national systems, and that I think will just take more time than we can do now during the pandemic. So for now, it would be very helpful for us to for the fall, when the compounding effect of influenza and other respiratory diseases will come, to have a system that captures all of these in a syndromic way, where we can do a strategic testing of them for all the viruses that circulate, to get a picture and separate the influenza and the RSV and the COVID.
That's a huge issue right there, and I would love to ask more about it, and I might, but I'm going to move on to Josep in a moment. Before I do that, I'm just going to remind everybody who's participating that you can be posing questions as well. We have the Q&A function, so if you click on the little question icon in the bar in Teams, then you'll see the Q&A, and you feel free to pose questions there that you would like to follow up on. But if you don't, then I'm going to follow up on that one with Andrea in a little bit, because that's fascinating. Josep, as the director of the European Observatory on Health Systems and Policies, of course, the observatory plays this really important role in bringing together information, but as with the ECDC, this has been an enormous challenge under huge time pressure during this period. But in partnership with the World Health Organization Regional Office for Europe and the European Commission, you have launched a health system response monitor tool which systematically maps and analyzes health system responses to COVID-19 across this European region, which is a huge step and a huge process. Could you tell us more and maybe show us a bit of what that actually looks like?
Thank you, Nick, and thank you to be here with you, and very good friends also in this platform. What Andrea said basically is exactly very similar of what we faced, and the question of Trump, sort of whether speed trumps perfection, has been exactly at the core of our questions at the very beginning. We decided to go for a speed, but I think there's a bit of a fallacy, by the way, as we talk about that on this issue. But I think you can have perfection if you share uncertainty. So we decided to go for a speed, sharing uncertainty and knowing that the perfection wasn't quite there. And we faced exactly the same issues. As we put in place this website, this platform, more than a website, as we put it in place, I'm sharing it now, we face the issues about who can work with it, what are the country correspondents. So we were lucky we had already a network covering all European member states that we could ask them to come on board. As Andrea said, we could not rely on ministries of health because we're very busy handling the pandemic. So we could rely on this network of analysts that are working with us on a regular basis, and to try and put together a first monitoring of the response. In the first instance, we were not very ambitious. We went for data. Data in this case is qualitative data, complementing with excellent data that the ECDC has, with the data of WHO, Johns Hopkins, and other platforms, trying to complement both, but going very much on the actual responses. So you see the web in front of you. We have three areas basically in there. One is looking at a country. Let's say, for instance, we could take Austria, as this is partially based in Austria, although we're all online, thanks to our colleagues in the Gastein Forum. So you can see in there we have a link, obviously, to the database on the right, on the database, quantitative databases. We have the information, the health systems, but the focus of it is on the policy responses. So again, this is all about how do you tally, how do you respond to the policymakers. So we organized our policy responses according to a number of categories. I don't know whether they can be seen well into the screen now. So areas where the policymakers were struggling with. So improving prevention and transmission. So we looked at all these categories: communication, physical distancing, location and quarantine, monitoring, testing. And we collect data, as I said, for all the European countries, all the countries of the European region, obviously including the European Union. So then we looked at issues around physical infrastructure and workforce capacity. Again, there are a number of important issues to consider there. Like the workforce, the incentives for the workforce, the special payment systems, the areas to support that workforce. I don't want to go into much detail. There's other categories like providing services effectively, paying for services, and then all the mechanisms of governance. The web allows you then to go, I won't take you through, it allows you to compare. So it allows you to look at all the various countries, click them, and then see their responses according to the countries you chose and the topics and subtopics that you decide. For instance, if you want to compare 6 countries on measures on physical distance, you would go here, you would click, you get a PDF of that information. But the area that really has major value added into this work is the area of the what we call policy snapshots. In there, what we did was trying to let me show you the cross-country analysis. What we do is ask member states questions about issues they try to resolve at a particular moment. So it's very much quick, 2-3 pages, looking at what's there, what is the experience, trying to identify innovative practices, not best practices, because again, I'm going to go back what Andrea was saying, that we don't have the data to measure the impact of these practices. We have problems on all levels. We don't have the number of cases. As Andrea said, we need to do a number of adjustments. We don't have the right mortality levels. We don't know what is the actual mortality. We have to rely on excess mortality, and that's not available for many countries. And even in the overall denominator, the population, we are actually comparing countries that considering their differences in risk factors, age, demographics, diabetes, cardiovascular disease, and so on. So that was our major challenge. We're now to address in a major proposal, which hopefully is going to be financed, in which we're trying to relate behavioral changes, a number of impacts on better data on mortality, better data on mental health, better data on the impact of other areas of the health service and other diseases. But just I'm going to wrap it here. I don't want to take too much time. The proof in the pudding, as they say, is in eating it. So I hope that's enough for colleagues today to go and check it. But just to give you an idea of some of the recent posts here, the most recent one, June 26, is that how are countries compensating health professionals? This is a key question and institutions for COVID. This is a key question we got from many of our social health insurance countries. We have as well data on the role of civil society. Has been fundamental. How comparable is COVID mortality across countries, for instance, is a very important one, as Andrea was saying earlier. Here we looked in this table, we look at the differences in diagnosis, the differences in the way that countries use diagnostic criteria to say whether someone died from COVID. On the left here, you have those countries that have been using the WHO criteria, using clinical diagnosis. On the right, they use test-based. Surprise, surprise, when you then look at the data on excess mortality, you'll find that those countries that use the first criteria, they have their COVID recorded mortality much closer to the excess mortality. And that's only one of the 30 questions we've been addressing, so the lessons there is trying to meet quick questions, acknowledge uncertainties, acknowledge problems, as I've been doing now. Timeliness is fundamental, and responsiveness, and frame it in a way that makes sense for decision making. Over to you, Nick.
Thank you so much, Josep. It's absolutely fascinating to see that. And I have to say, and I can say this because I've contributed only in the most minor way possible to that. It's been an enormous amount of work by an enormous number of people in a very short period of time, and I think you and your colleagues to be congratulated on that. And it's also an example of sort of learning in real time, constructing an entire sharing of knowledge, an entire platform and network of people, the policy snapshots you described. this is incredibly compressed in comparison to the normal sort of timescales that we're working in. And so, I mean, obviously you and the Observatory have a lot of experience as knowledge brokers in normal times, as it were. What has there been anything special about the role of this kind of knowledge brokering role of an organization like the Observatory during this period of time of the pandemic, in terms of different ways of working or different roles that organizations like the Observatory have played?
Absolutely. I mean, it's a totally new ball game altogether. There are many interesting elements, depressing and worrying elements, I would say, emotionally, actually, and I don't want to go too much there, in the way that this pandemic has operated and in the role of trying to bring that science to practice and to policy. The degree of uncertainty, we've been talking about that a lot. The need, I mean, we've been looking at resilience, we're looking at the ability of health systems to respond, and clearly, the ability, those countries have the ability and genuinity, if you want to say it that way, to share that uncertainty, have got much more trust and compliance from their population. So that's been very much the importance of that knowledge brokering. Third, the challenge has been particularly complex is the way that in situations of emergency, you get science, policy, and politics as one. So that's already complex in many instances to separate these elements, as you know, and we do knowledge brokering. But in this case, all that compresses into one, and disentangling those, trying to maintain that independence. And we have a number of countries where we haven't seen that independence has been very negative when we haven't seen that independence. So for knowledge brokers, have that trust, create that trust by sharing uncertainty, by going into that independence, by separating clearly what it is, the values and what it is, the evidence. These are some of the elements that I think have been particularly key in knowledge brokering on these times of COVID.
Thank you, Josep. Trish, I want to turn to you now, and I want to actually ask you questions which arise from what the previous speakers have said. I hope that's okay with you. This is a subject, of course, that, as many people will know, you research, among many other things, this whole, as well as contributing evidence into policy, you research these whole processes of how this works. What are your reflections? And these are always, isn't live online stuff brilliant, eh? This is exactly when the phone call was. I know that you research not just provide in evidence into these processes, but how these processes work. What are your reflections on the kinds of processes that you've heard about from Liisa-Maria, from Andrea, and from Josep?
Yeah. I mean, I think this is really interesting that when you look at the Observatory website, for example, and I looked at that a lot in the beginning, and I went there as a source of facts, but actually, of course, facts are value-laden. You can't just disentangle particularly the quantitative data from the context in which it was generated and the reasons why people went to look for it, because as we've heard from Andrea, people were really busy, and anybody who's put a lot of effort into putting together some data has got reasons for doing that. And I think the whole kind of, I was very struck when Josep was speaking about the ethical nature of some of the questions that they were asking. I mean, the one that I picked up on was, how are countries compensating health professionals? Well, why is that question being asked? Why was it important? And the answer is, well, actually, because it's an ethical question. It's also an economic question, of course. But I think one of the things that those dashboards were doing was actually conveying values. And as someone who's now a kind of victim of Brexit, I look at those European comparisons as part of the ethical drive of the European project. Let's put the data out there so that we can all learn and raise our game. And I think that kind of comparing the stories, comparing the ways in which countries were making sense of their data was absolutely key to this. So yes, and the other speakers have already said this, but you cannot disentangle the science from the policy, from the values. I think they're all tied in, and I think you guys did really well, is what I'm saying. Absolutely amazing.
And yet, of course, in academia, we quite often do see ourselves as trying to be disentangled from policy, and we have this very remote process where there's research that goes on and it takes years, and you submit papers to journals and they bumble through the process and come out maybe months or years later. What has been the role of academia and of research during this period of time?
That's an interesting question, because as you know, Nick, I get very frustrated at the pace of academic progress. How long does it take to get your paper peer reviewed, for example? And I actually was sent a paper the other day which quoted a tweet of mine which I posted in March, and it said, I'm fed up with people saying it takes 17 years for research to get into policy and practice. And I said, in the last few weeks, we have seen research findings, research done in days and published in hours, and policy changes happening in minutes. Now, that isn't always the case, but there have been a few situations when really key findings on sometimes quite small studies, but they were totally pivotal. And then we realized, for example, proning was quite a good example. Somebody discovered quite quickly that flipping patients over onto their fronts was preventing the need for a ventilator, for example. That got into practice really, really quickly once someone published some mortality statistics. So I think research did kind of get faster. On the other hand, we all know the downside of that, which was there's something like 50,000 papers now have been published as preprints. And some of those are not worth the virtual paper they're printed on. They're not good science. They haven't been peer reviewed. And I was just writing a review article yesterday, and it's really, really difficult to distinguish the good stuff from the bad stuff. I mean, that's what I'm trained as. I'm a professor, I can do it. But, most people looking at the published research, they don't know what a preprint is. And I think we're in a big mess. So one of the things that the research community has got to do is to say, yes, we've got to publish stuff quickly, but my goodness, we have got to sharpen up the quality control of rapid research, rapid publication, rapid dissemination, because otherwise we're going to get into even more of a mess in the next wave.
That's a really interesting point. Thank you. So, as I said at the start, we would have an initial round from each of the speakers, and my thanks to everybody for the very interesting points that they've raised. What I'd like to do now is come back to you as the participants, as the audience in today's event, in two ways. Not only to come to some of the questions which have been asked, and please do feel free to ask more, but we also have another poll, if you like, or but it's in a slightly different format this time. So now, and perhaps colleagues, you would put that up on the screen. So thinking long term, what are the key aspects to consider in this interface between science and policy and politics during a pandemic? And what you can do this time is, rather than Trish having to vote for a single alternative option, just put words up there. What do you think are the key words? What are the key one-word responses? And we'll get a word cloud out of that, of some of the different ideas and issues that people want to that people think are important in considering this interface between science, policy and politics. So, for example, Trish, you just talked about the quality of research, for example. So let's see what kinds of ideas people come up with in terms of this. So trust is one obvious thing that is going to be very, very important. And then I'm just going to give people a couple of minutes to put in your one-word answers to that, and then we'll see where we can where we go with some of the questions. I wonder if the less and the science go together there. I'm not sure. Transparency, trust coming through. Let's see what other issues people raise. Very interesting. But I'm struck by the fact that there's a wide range of issues there. There's accountability, there's data, there's transparency. But these questions of trust and communication are sat right in the center of all of this. Very interesting. I'm going to move on from this purely because we have a lot of really interesting questions which are coming in, and I'd like to move to some of those now. So, colleagues, my dear panelists, I hope you will forgive me. I'm going to pick on some of you to answer some of these questions. So be ready. And do feel free, as we discussed earlier, to indicate which ones that you would particularly like to answer. So one of the questions that's been asked here is about the impact of not just the data about the pandemic itself directly, but the data about the impact that this is having on other types of healthcare. Specifically, there's been a question on the impact on cancer patients, for example. And Andrea, you mentioned in your introductory remarks about the importance of being able to disentangle this autumn data about COVID from data about influenza and other sort of infectious diseases. I guess the question is, do we even have the right kind of data that allows us to assess the impact on other forms of health services, and how might we generate and learn from that kind of data? And I might start with you, and then Trish, I might come to you after I've asked after Andrea has had a chance to talk about that. Andrea, over to you.
Yeah, thank you, Nick. That is a question that started bothering me as of early February, when I realized that everybody is just focusing so much on COVID and all the other diseases. And I'm talking here predominantly of infectious diseases, which is our remit. We heard nothing. And I was so concerned that we would overlook an emergency with another disease just because people don't have the time looking for. Now, the impact in infectious diseases that we know of was on the vaccination programs. So many countries reduced their vaccination programs, especially at the beginning in March, April, to the mere childhood necessities, and even some countries suspended those. So we have to deal with definitely with a group of non-immunized people, even more than we usually have to. So here I think that has to have a focus. But the question here was more on the chronically ill people, because elective operations, elective screenings, elective investigations have been postponed, and that is part of the normal screening and follow-up for these diseases. I mean, I can't say much to this because this is not what we're monitoring, but I'm also concerned about there are some chronic events, or not chronic acute events, like myocardial infarctions, stroke, where it's so time critical that they get soon a medical assistance. And I wonder what happened there, because what I read is that these people didn't want to go into a healthcare setting. And the other thing is even a bit wider in the sector. I know that a lot of the drug centers, the treatment centers for the drug exchange programs have been commissioned to provide the surge capacity for hospital beds, and so also these services were down for the in vitro fertility. I mean, there, you know, the whole impact on these not core healthcare but related services. I don't think we have an idea about this right now.
And of course, our data collection structures for that at European level are much weaker, obviously, for all sorts of reasons. Trish, I know that you are also a clinician, and I know that you've been very involved in the sort of the clinical responses to COVID as well. What do you think about this indirect impact on other healthcare needs?
Oh, absolutely. I would say that in the UK, I think it's primarily not cancer diagnosis that's the issue. I think the thing about cancer is pretty much everybody knows you've got to keep up the pace. Even patients know that query cancer is urgent, but what we are seeing is a rather more mundane people who just haven't had their blood pressure checked for a while, and you know that means that we're going to see more strokes. You know, it's that kind of low level, low grade people who weren't feeling ill. They haven't had a dramatic symptom. They just haven't had the diabetes check, the asthma check, you know, the mental health checkup, all that kind of thing. Really, really important. Can I, while I've got the floor, Nick, make a comment on something I've just put in the question box, which is a paper on FUPS. Now, people, when you did that second exercise and people were putting in the one word things that they thought were really important, it reminded me of this paper by Miranda Woolpert and Harry Rutter about FUPS data, which is a description of data which has 4 characteristics, and it's absolutely what the COVID data is and was. The F stands for flawed. The data quality at the beginning isn't great for reasons that we're all aware of, and we try to improve that quality. Secondly, it's uncertain, and uncertainty was a big word that people were putting over. You know, that really characterized the data in the pandemic. Thirdly, the P in FUPS stands for proximate. In other words, we're using surrogate endpoints in a lot of the analyses. We're not actually measuring what we really want to measure. We're measuring some other proxy measure. And finally, sparse. And what they mean by sparse is you've got data on some subgroups, but not others. So that, you know, the question of, for example, Black and minority ethnic groups, that came out much, much later. Now, what do they say we need to do about that? Under conditions of hypercomplexity, and this is really key. The first is we need to be honest and treat the data as a partial remnant. In other words, the data is only part of the totality of understanding. Secondly, transparency. We need to be honest with everybody that this is not perfect data. And triangulation. We need to triangulate different data sources against one another. But finally, they say in this FUPS paper, when you've got FUPS data, when that's all you've got, you have to make decisions with reasonable chance being the basis for change, rather than saying it's perfect or it's not perfect. We know it's not perfect, so let's take the reasonable chance as the basis for change. So that paper that I've linked in the chat, in the questions, slot, gives you a theoretical basis from complexity theory around the kind of data and the kind of decision making under uncertainty that was and is happening. So I hope that's helpful.
Thank you. Yes, absolutely. And it's this, we have to acknowledge the reality of the situation we're in terms of evidence and adjust our kind of responses accordingly. Josep, I want to come to you actually on a following question from that, which is around the question of, okay, so let's assume that countries make different policy decisions. Different countries seem to have been quite differently able to translate those decisions into what was then happening on the ground within different countries. I know this always becomes a sensitive question when looking at sort of comparisons between different countries, but is there anything that we can learn, do you think, about about looking between different countries, about what helps countries do better in terms of being able to translate policy into action, and what sometimes hinders those kinds of processes?
Yes, I think we already threshed out some of those issues, and Trish in her comments was making many of those points. Clearly, I think I'd like to take this question a slightly different way, if I may, Nick. I think I was reflecting in Stoic principles and knowledge translation these days. I think there's an element of humility among knowledge translators that should be at the core of that. And there's an element as well of acknowledging our values and suppress those values as well while responding to policymakers. Going back to the point of Trish earlier, our job is to be as objective as possible, and the Observatory, we put a lot of work on that, using very detailed templates, using editors, questioning, and always responding to the questions of what policymakers want, trying to make that uncertainty open, trying to make the value trades open. But if the question of a policymaker is on values, our job is not to put forward our values. Although many commentators today are saying that there's so much unethics in the way that some policymakers have taken decisions, that we, the knowledge brokering, the expert, the science community, should advocate. Our colleague Martin, for instance, is saying that, and I would agree with that, but always with a different hat. And I think that's, going back to your question, one of the issues we've seen across countries. We've seen countries in which the knowledge brokers, the scientists, have taken quite a position, both as knowledge brokers and criticizing or supporting government. I think it's wrong. I think that doesn't help. And I think the countries that's worked the much best is, and it's been said, and it has to be said again, honesty and transparency and uncertainty. And remind you that policymakers are much better than we are, scientists or knowledge brokers, on dealing with uncertainty. They are quite happy to deal because that's their lives. So sometimes there's a bit of paternalism trying to say, oh, no, the juries are still out. Oh, no, we need better quality. I think our job is to say, this is what we got. This is the level of uncertainty. This is the level of quality. This is some of the projections based on that. I think what's been really, really negative in some of these countries and positive at the same time is the way that modeling has been used. Modeling is a great tool with huge impact. When people see that 300,000 people are going to die, people wake up and people follow those decisions. However, I think some of our modelers have been very disingenuous in accepting the limitations, on showing the limitations of their models, showing that many of them are done with high levels of uncertainty and are only based on epidemiological elements without taking into account behavior, without taking into account many values that they were not presented in the model. I haven't addressed perhaps directly, but I think these are important elements of those countries that done better than others. Triangulation, I'll stop it here, as Tricia said, is fundamental. Take the Germans and the Danes have been very good at triangulating data from different sources and looking at other countries to look at the situation in their own country. Over to you.
Thank you very much. I think one final point that I would want to sort of, before I come to you for your final sort of 30-second key takeaway messages, colleagues, that's your advance warning. Maybe just one, I was going to have one more question out of the Q&A. And I'm sort of trying to combine several here around the sort of the wider issue. We've been very focused on the health system, and we've been very focused on the health dimension of this problem. But there's the wider society, and there's the wider impact and involvement and contribution to the problem. So there's the public health and community response, and there's the impact on wider society and different groups across society. I don't know if any of the three of you would want to say anything about what we should be doing now in terms of that wider societal set of issues and our wider response to those issues. Apparently not. You're all ducking that wider societal question, because it seems to be. Go on, Josep.
I'm always happy to answer a question, but I think my much more learned colleagues are much better at that. In fact, what I can do to save us time, is wrap it up with my final comments, which wanted to go in that direction, Nick, precisely. I think as we go into the next curves, because it's not if, but when. That's going to be the issue. I was surprised to see that only 5% of the respondents talked about the economy. Make no mistake, that's the issue. The lockdowns will not happen because of the impact in many countries, because of the possible impact on the economy. Number two, the disaster with our nursing homes is something that we need to, it's a wider society issue. It's not just an issue of COVID and nursing homes. What that revealed is a fundamental issue in the way we've been having the poor quality of nursing homes, the non-trained staff, the lack of medical support, the lack of spaces. So the nursing homes, yes, it's been COVID, but it reflects a real problem. How do we treat our elderly? So these are the kinds of issues. So two aspects of my wrapping up, as it were. One, humility as knowledge brokers, humility as policymakers. This is important as well because we see how populism is going to have finally a hard time on this one, because the virus doesn't believe on populisms, doesn't act according to populisms. So humility is my very key aspect to wrap that up. And secondly, now is the moment to look at all these other societal aspects, responsibility of government and accountability of different groups, accountability of the population, civil society, look at these broader issues of economics, of the vulnerable people that are going to be the ones affected by this pandemic. So indeed, it's now the time to look at these aspects as we are waiting for the scientists to deal with the treatments and immunization.
Thank you, Josep. I will come to Trish and Andrea in a second for final thoughts. Before that, specifically on this issue, Josep, that you raise, Dorley, this is one of a series of webinars that the Gastein Health Forum is going to be organising, and so I'd invite people to look out for future events. And I think in the coming months, one of those is precisely intended to be on the impact of COVID-19 on vulnerable communities and how this relates to entrenched inequalities. So I think this is something that hopefully we can go into more details on in a future event. Trish, your final 30-second thought, please.
Yes, I think Josep encapsulated the bigness as well as the complexity of all this, that as we emerge from what we're still calling the first wave, vulnerable groups are looming large, neglected groups, the non-COVID sick, that kind of thing are beginning to loom large. And sometimes it's really hard to get your head round the bigness and the complexity. And I would actually encourage people to take the world in a grain of sand, take a single case, take a single individual who has been deeply affected by COVID, who's, for example, lost their job, who's been bereaved, who's got, different elements of social determinants, and understand that individual's position in depth, because from there will come the key questions to take forward. The story about an individual will inspire the moral imagination, and it will guide us in suggesting what the next questions are, what data should we be collecting. So that's my 30 seconds at the end.
And we are back to stories and narratives. Thank you very much. Andrea, a final thought.
Yeah, thank you. I believe that this pandemic has really shaken the foundations in very, very many aspects of our life. When I take the medical sector, I mean, we had to go back to measures that the old Venetians put in place for the ships with the plague in the medieval times, and we had to realize that's the only thing we have. I think that required some thinking, but it also has, as you mentioned, shaken the foundations of other pieces of the society and highlighted some gaps that we have. This is why I believe firmly we have to learn from this pandemic in all the aspects that it could teach us in a systematic way, because otherwise we will not move forward. Thank you.
Thank you very much. We have to learn also how to learn, taking on Trish's point about quality control, but I know that each of the speakers here is an example of contributing in the highest possible way to that learning, and I thank you all for taking an hour out of that contribution that you're making to come and be part of this webinar. Thanks also in her absence to Liisa-Maria, Voipio, Pulkki. Thanks to Dolly and the whole Gastein team for organising this event. To all of you who participated, please keep an eye out for future events to keep these Gastein conversations continuing. Even in the absence of the physical forum, these virtual forums will continue, and I hope that you will continue to be part of them. Thank you very much.